Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today we're presenting a video that's really only relevant to people transitioning onto Medicare or thinking about doing so soon. As we've discussed before, that transition onto Medicare is more complicated than it used to be because there are more parts of Medicare. C and D, there's many choices. And so I want to talk about what can go wrong even when you've made all the decisions and accomplished the enrollments that you intended to, have all your cards, and then the claims aren't being processed correctly. And often that is a problem because Medicare has not changed its records to reflect that Medicare pays first. Now, this is more of a problem for people who work beyond age 65. But you know what? I would recommend that everybody call the 800 number to see what Medicare has on file for them. And I mention that because this year we've had two clients where we thought everything was done correctly, everything reflected that Medicare would be primary on a certain date, and they still had problems with claims when that transition occurred because somehow, the process got undone. We don't know how that happens, but it did. So I think the best thing to do is to just walk you through, and I'll use myself as a guinea pig. I am on Medicare Part A, but that is not primary for me because I am on my husband's plan. My employees are on yet another plan. So let me give you this telephone number for the Medicare Benefits Coordination and Recovery Center. It is 855-798-2627, and let us call it so you see how this works.
Welcome to Medicare's Coordination of Benefits and Recovery Call Center. For quality assurance purposes, this call is recorded. Para continuar en español,
So we have to be a little patient, I'm sorry to say.
If you have a red, white, and blue Medicare card or are entitled to or receiving Medicare benefits, press 1. If you are calling, online Medicare service is available at mymedicare.gov. If you would like more information regarding Medicare health plan choices, including prescription drug plans, a Medicare summary notice, or would like a Medicare publication, press 1. Otherwise, I will need your Medicare number. You will find this information on your red, white, and blue Medicare card. I will also need your last name, date of birth, and last 4 digits of your Social Security number or 5-digit zip code. If you are entering a Medicare number, press 1. Social Security number, press 2. Using your telephone keypad, please enter your Social Security. Please hold while we locate your record. Please speak your date of birth. For example, January 5th.
I just punched that in.
Now speak your last name as it appears on your Medicare card.
Carly.
Please speak your 5-digit zip code 1 digit at a time. For example, 12345.
06820.
Medicare is not primary. For additional coverage status, press 1. To report Medicare is currently not primary for Part A hospitalization insurance. You are not entitled to Part B supplementary medical insurance. You are not entitled to Part D prescription drug coverage. To find out if Medicare was primary on a specific date, press 1.
Okay, I'm logging off now. You get the picture. And you know what? That's so well worth doing rather than risking your claims not being paid because this system hasn't been updated. That's much more of an intervention. It's actually pretty straightforward to get to a person when you dial that number and the information is not correct. But I hung on the phone there for a little bit to emphasize that that system is saying I'm not entitled to Part B and I'm not entitled to Part D because I haven't enrolled in them, but I am eligible. So I hope you all remember the video on eligibility, entitlement, and enrollment, or I think entitlement was the last one there. So again, take 5 or 10 minutes and call this number, 855-798-2627, and make sure the Medicare COB unit has the correct information on you. We would hope that would happen more easily, but don't count on it. Just cover that base. All right, thank you for listening today. I hope you have a wonderful day. Tell people to watch our videos, please, and take good care. Bye-bye.